about to prepare you for what is about to go down. Literally, what is going to come out of your body. I cannot wait to tell you what's going to happen. I took birth class after birth class, learned about birth. I was a pelvic floor physical therapist, for goodness sakes, when I gave birth to my first baby. But it took me developing the body motion birth preparation protocol to truly understand what needs to happen to prepare the body for birth and truly allow you to breathe the baby out. So stay tuned, because I'm about to teach you the magic sauce for how to get this baby out of your body. Babies are huge by the time they're 9 to 10 months old, right? Inside of our bellies. Obviously, then they're born, it's day one, but just bear with me here. They can be the size of a watermelon, and they have to get out of your body somehow. And really, you don't want to be torn apart, so let's find out exactly what you need to do in order to get this baby out of your body. The current standard of birth class and everything you do during pregnancy isn't enough to prepare you for delivery. You can take your birth class and figure out the phases of labor, figure out transitions, and figure out, oh, maybe I push when I'm 10 centimeters dilated. You might not even know what that even means when you're first pregnant. But here's the deal. You can really Google all that stuff. What you can't Google is how to breathe your baby out of your body without tearing yourself apart. So stay tuned. That's what we're going to go through. The first thing I need you to know is that what you typically learn from your OB, from your midwife, and from your birth class is that you just hold your breath and push. And when you get to the delivery room, you are told, hold your breath and push. But the reality is we don't want to be doing that. And so we're going to talk through how to breathe the baby out so you don't tear yourself apart. And I will get to that. First, I have some what not to do's. And what I do not want you to do during your pregnancy is we do not want you to do Kegels. When you do Kegels, even though they're often prescribed for birth training, when you do Kegels, what happens is that your pelvic floor tightens. The reality is pregnancy in general tends to make your pelvic floor tighter anyways. So we don't need to work on the tightening of the pelvic floor. We need to work on the opening of the pelvic floor. And that's what's going to allow baby to get out of your body without tearing you apart, without stalling labor, and without predisposing you to a C-section. Pain during pregnancy is the first sign that you have a tight pelvic floor. And that should be the first sign that your pelvic floor is too restricted. And we need to train that pelvic floor to open up and relax. The deal is when your pubic bone starts to hurt, when your back starts to hurt, when your hip starts to hurt, even when your neck starts to hurt, our body goes into more of a fight or flight response. We become tightened and constricted, and the pelvic floor squeezes. Just another side note and reminder, that's when you don't do Kegels. So we have to teach the pelvic floor to open up. Pelvic floor manual physical therapy using birth preparation protocols by body motion is the gold standard for helping you open up your pelvic floor to get the baby out of your body safely without a lot of damage to you. A couple of my absolute favorite birth stories of women who use the body motion birth preparation protocol. This one woman named Cynthia, she had a horrific first birth, so bad that they didn't want her to have another vaginal delivery. They wanted her to do a C-section. And she did our body motion birth preparation protocols and was able to have a surprise home birth. She went into labor. It happened so fast. She just worked on her breathing, breathed baby down and out, and she had no tearing. And after severe tearing the first go around, which was almost a surgery to repair her up, she responded with no tearing when the doctors didn't even want her to have a vaginal delivery. So it's one of my most epically favorite stories. Another story by a client named Emily. She came to us after her first baby. She had severe prolapse and really worked on her pelvic floor during her pregnancy in order to protect her bladder. She ends up going into labor, is breathing baby down, vomits, and the baby just comes out of her body, and she has no tearing, doesn't push. It was a complete and utter surprise. No one was in the room. And these are just some simple examples of how easy it is to get baby through the birth canal when your pelvic floor is relaxed and when your pelvic floor can open. The uterus is what does the job to push the baby out of the body. When the uterus is doing its job and it doesn't have to work through the resistance of a tight and shortened pelvic floor, then the pelvic floor can relax, we can relax, we don't have to do much work other than breathing and opening the pelvic floor. Then the uterus just squeezes during the contraction and baby can come out. Now, it might take multiple squeezes, but as long as you can maintain a relaxed pelvic floor position, you are going to be in really good shape for the vaginal delivery of your dreams. So more of the story is you want to make these contractions work for you. In order to do that, you have to breathe through them. And how we do that is by using our diaphragmatic pelvic floor opening breath. What happens when you do that is you take nice deep belly breaths. So you take a nice deep breath into your belly. As you inhale, your diaphragm descends down onto the uterus and the pelvic floor needs to open with the inhale. You exhale, your pelvic floor will recoil a little bit. You inhale, pelvic floor should open. You should be able to feel that in your body, and if you don't, that's the number one sign that you need the body motion birth preparation protocol. Here's the consequence of what's really at stake. The reality is every time you are in labor, you're going to be surrounded. If you choose to deliver in a hospital setting, at a midwifery clinic, you're going to be surrounded by people that are cueing you, that are wanting the best for you. They want to cue you how to get this baby out of your body. And so how most people are taught to do that is by telling you to hold your breath and push with all your might to get the baby out. That can cause a lot of damage to you, that can cause a lot of damage to your pelvic floor, and not only are you pushing the baby down and out, but you are pushing your bladder, your rectum, your pelvic organs, which is going to predispose you to a prolapse. So when in doubt, if you can, use the breathing baby out method, and that is going to give you the best control of your pelvic floor. That's going to give you the most opening of your pelvic floor, and it's going to take a lot of discipline to ignore those voices of those that are yelling at you, hold your breath and push, hold your breath and push, and just say, no, I'm going to breathe my baby out. It might take a little longer. Now, there are caveats to this. If you are having a medical emergency, that would be a time where you hold your breath and push. But for the most part, you have to know how to breathe baby out and be practicing this during your pregnancy. And that will give you the confidence in the delivery room to really, truly lean into knowing that you can breathe this baby out of your body. The number one feeling that you are going to get is if you have to have a really deep bowel movement that you can't hold in. That is often the sign that you are 10 centimeters dilated, fully effaced, and ready to get this baby out of your body. The number one thing that I teach to the hospital setting nurses, so I onboard the OB nurses once a quarter, and what I teach them is I teach them how the diaphragm descends into the belly and that causes the pelvic floor to open. So the diaphragm, how you breathe and how your pelvic floor moves are very connected. And so I teach them how to cue clients and patients when they come in for delivery. I teach them, train your clients to use this type of breathing to help open up the pelvic floor. And if you can get your client to do this type of breath pattern, it's going to save you holding their legs for hours, yelling at them, hold your breath and push, and it will oftentimes speed up the delivery process just simply because they're not having to work so hard and they can relax into it and their pelvic floor can relax. Now, it's a lot easier to be practicing this throughout your pregnancy in order to have the range of motion and the control to get the pelvic floor open so you are ready for delivery. But this is the number one thing that we're trying to change. We're trying to change the culture of how OBs are trained, how OB nurses are trained, and how midwives are trained, because if we can all get on board with this is the physiology of how baby comes out of the body, we're going to save moms tremendous amounts of injuries, tremendous amount of tearing, lots of prolapse, and all of that. When they don't have that, their recoveries are going to be that much better. Let's not even talk about their short-term recoveries. Let's talk about their bodies in 20 to 40 years. When you don't have that kind of damage after childbirth, you are in a much better place when you're in your 40s, 50s, and 60s. You have your core intact and still working for you. When you have tearing, when you have prolapse, when you have dysfunction after childbirth, you have to work through those issues with a pelvic floor physical therapist in order to restore your core. But many people don't get get their cores restored after childbirth. And so they end up with these dysfunctions that impact them when they're, at postmenopausal, or when they're in their 50s and 60s and they need a hip replacement or a knee replacement, all because they never really got their core back after having kids. So this is why this is so absolutely important. This is why it's my mission to teach people how to breathe baby out of their bodies so that we can protect ourselves. I had trained my body for this experience and I was prepared. And when I implemented the body motion birth preparation protocols during my third pregnancy, that is what gave me the confidence to just breathe baby out once I got that deep urge to push. So it's an extremely effective tool. Most of our clients push their babies out in under 20 minutes on average with no tearing. So go ahead and start implementing this today, and this will help guide you on the birth of your dreams. This is just the beginning. This is the quick notes version. If you're like me and you want more information, I want you to go and watch this workshop that is going to prepare you further for your pregnancy, keep your body pain-free, and that will keep you in a really good spot to prepare for delivery. So go watch that workshop. You're not going to want to miss it. It's completely free. Check it out.